Today I am going to explain about headache. What is meant by headache? What is the mechanism behind that? ತಲೆನೋವಿಗೆ ಕಾರಣಗಳೇನು, ಯಾವ ಕಾರಣದಿಂದ ಬರುತ್ತೆ, ಅದ್ರ ಬಗ್ಗೆ ನಾನು ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡ್ತೇನೆ. So we can divide into two types, primary headache and secondary headache. This is the two main divisions, primary and secondary. Primary means there is some problem in the head related to head. Secondary means that may be some other infection causing headache. ಇದು ಎರಡು ಕಾರಣದಿಂದ ಬರುತ್ತೆ. One more classification is cluster headache, migraine headache, and third one is sinus headache. This is one more classification. Like this we can do the two classification. Today I am going to explain about sinus headache. In that, cluster headache, second is the migraine headache, third is the sinus headache. Many people they will suffer from sinus headache. This is the one more classification. What is meant by sinus? Sinus means there is some opening in the body or wherever it may be. This one opening is called sinus. ಒಂದೇ ಕಡೆ ಓಪನ್ ಆಯ್ಕೊಂಡಿದ್ರೆ ಸೈನಸ್ ಅಂತ ಹೇಳ್ತಾರೆ. If there is two opening is called fistula, right? If there is one opening is called sinus because he is also a doctor. He knows about all these things. If there is only one opening is called sinus. If there is two opening is called fistula. There are many sinuses in the body. Some sinuses in the brain, some sinuses in the nasal area, and some arterial sinuses, some venous sinuses, sigmoid sinuses. There are many sinuses in the body. With respect to the sinus headache, this is paranasal sinuses. This is surrounding the nasal area. It is called paranasal sinuses. ಮೂಗಿನ ಅಕ್ಕಪಕ್ಕದಲ್ಲಿರುವಂಥ ಸೈನಸ್ಗಳಿಗೆ ಪ್ಯಾರಾನೇಸಲ್ ಸೈನಸಸ್ ಅಂತ ಹೇಳ್ತೇವೆ. There are mainly four sinuses in the paranasal area. This is frontal sinus, one pair, maxillary sinus, another pair, sphenoid and ethmoid in the back side. There are four sinuses in the paranasal area in the head. What is the function? ಇದರ ಕೆಲಸಗಳೇನು? This makes our head lighter. ನಮ್ಮ ತಲೆಯನ್ನು ಹಗುರ ಮಾಡೋದು ಕೆಲಸ. This makes our head lighter. Like our head is around 1.5 to 2 kg, we won't feel any heaviness in the body, heaviness in the head, in the normal condition. ನಮ್ಮ ತಲೆ 1-2 kg ತೂಕ ಇರುತ್ತೆ, ಅದು ನಮ್ಗೆ ಯಾವತ್ತೂ ತಲೆ ವಜ್ಜೆ ಅಂತ ಅನಿಸೋದಿಲ್ಲ. Whenever there is problem, whenever there is sinusitis or any secretions filling the sinus area, then we feel heaviness in the head. ನಮ್ಮ ತಲೆಯನ್ನು ಹಗುರ ಮಾಡುವಂಥದ್ದು ಸೈನಸ್ಸು. ಯಾವಾಗ ಸೈನಸ್ಸಲ್ಲಿ ಫ್ಲೂಯಿಡ್ ತುಂಬ್ಕೊಳ್ಳುತ್ತೋ, ಸೈನಸ್ಸಿನ ವಾಲ್ಯೂಮ್ ಕಡಿಮೆ ಆಗತ್ತೋ, ನಮ್ಗೆ ಅವಾಗ ತಲೆನೋವು ಬರ್ಬೋದು, ತಲೆ ವಜ್ಜೆ ಅನಿಸ್ಬೋದು. ಇನ್ ದ ಬಿಗಿನಿಂಗ್ patient complains of heaviness in the head. This is the first symptom, heaviness in the head. These sinuses are the air-filled cavities, air always moving upward direction. Like you have inverted balloon. So take one balloon, fill the air, tie one thread and leave it. Balloon moves upward direction. In the same way, all the sinuses are like inverted balloon shape, like this, like this. This is the mouth of the sinus. It's only one opening, it's called sinus. Okay, like balloon. Imagine the balloons here. This will move the head upward direction. So we won't feel any heaviness in the head in a normal condition. We feel lightness in the head. When this air-filled cavity is filled with some fluid, amount of air decreased, fluid content, water content increased, then we feel heaviness in the head. ಈ ಬಲೂನ್ ಇರುತ್ತೆ ಈ ಟೈಪು, ಈ ಬಲೂನಲ್ಲಿ ಗಾಳಿಯ ಬದಲಿಗೆ ಫ್ಲೂಯಿಡ್ ತುಂಬಿಕೊಂಡ್ರೆ ಏರ್ನ ಕ್ವಾಂಟಿಟಿ ಕಡಿಮೆ ಆಯಿತು, ಹೌದಾ? ಗಾಳಿ ಮೇಲ್ಮುಖವಾಗಿ ಹೋಗುವಂಥದ್ದು, ಗಾಳಿಯ ಕ್ವಾಂಟಿಟಿ ಕಡಿಮೆ ಆಯಿತು, ಆವಾಗ ನಮಗೆ ಹೆವಿನೆಸ್ ಆಗುತ್ತೆ. ಕೆಳಮುಖವಾಗಿ ನೀರು ಯಾವತ್ತು ಕೆಳಮುಖವಾಗಿ ಬರುವಂಥದ್ದು. ದ ವಾಲ್ಯೂಮ್ ಆಫ್ ದ ಏರ್ ಇನ್ ಸೈನಸ್ ಇಸ್ ಅರೌಂಡ್ 2 to 7 cc. 2-7 ml ಕೆಪಾಸಿಟಿ ಅದರದ್ದು, ಅಷ್ಟೇ ಸಾಕಾಗತ್ತೆ. ದಟ್ ವಿಲ್ ಮೇಕ್ಸ್ ದ ಹೆಡ್ ಲೈಟರ್. ಇಫ್ ದರ್ ಇಸ್ ಎನಿ ಸೆಕ್ರೀಷನ್ಸ್ fills the sinus, then we feel heaviness in the head. This is one of the important function of the sinus. This is a major function of the sinus that makes our head lighter. The second importance of the sinus is filtering mechanism. When we inhale the air, it will filter the air and passing through the lungs. This is the second important function. There are many turbinates in the nasal cavity. Inferior, middle and anterior. ಮೇಲೆ, ಮಧ್ಯ, ಕೆಳಗೆ 3 ಟರ್ಬಿನೇಟ್ ಇರುತ್ತೆ. ಅದು ಗಾಳಿಯನ್ನು ಕ್ಲೀನ್ ಮಾಡಿ ಲಂಗ್ಸಿಗೆ ಕಳಿಸುವಂಥದ್ದು. ಇದು ಎರಡನೇ ಇಂಪಾರ್ಟೆಂಟ್ ಫಂಕ್ಷನ್. ದೆರ್ ಆರ್ ಸಮ್ ಸೆಕ್ರಿಷನ್ಸ್ ಫ್ರಮ್ ದ ಸೈನಸಸ್ that makes our nasal passage wet. This third important function of sinus. ಮೂರನೇ ಇಂಪಾರ್ಟೆಂಟ್ ಫಂಕ್ಷನ್ ಏನಂತಂದರೆ ಮೂಗನ್ನು ಒದ್ದೆಯಾಗಿ ಇಡುವಂಥದ್ದು, ಡ್ರೈ ಆಗದಿದ್ದಂಗೆ ವೆಟ್ಟಾಗಿ ಇಡುವಂಥದ್ದು. ಇದು ಮೂರನೇ ಇಂಪಾರ್ಟೆಂಟ್ ಫಂಕ್ಷನ್. ದ ರೀಸನ್ ಬಿಹೈಂಡ್ ದಟ್ ಈಸ್, ಇಫ್ ದೇರ್ ಇಸ್ ಓನ್ಲಿ ಡ್ರೈನೆಸ್ ಇನ್ ದ nasal passage, all the dust will passing through the lungs. It may damage our lungs. To prevent it, our body will make this nasal passage wet. This continuous secretions from the sinuses that makes the nasal cavity wet. By that way, whatever we inhale the air that contains lot of dust particles, it will absorb the dust particles, only passing the fresh and good quality of air to the lungs. This is the third important function. And next is for the smell and increase the resonance of the voice. This is one of the important function only. Whatever we speak, that will increase the resonance. ನಾವೇನು ಮಾತಾಡ್ತೇವೆ ನಮ್ಮ ಧ್ವನಿಗೆ ದೊಡ್ಡ ಮಾಡಲಿಕ್ಕೆ. ಇಫ್ ಯು ಕ್ಲೋಸ್ ಯುವರ್ nasal passage and if you speak, there is no proper production of sound. This will increase the resonance. This is one of the major functions of the sinuses. What I told you, this is all physiology. This is a normal thing. Now I am going to the pathological condition. So these are all the things causing the disease. That's called pathology. ಇವೆಲ್ಲ ನಾನು ನಿಮಗೆ ನಾರ್ಮಲ್ ಫಿಸಿಯಾಲಜಿಯನ್ನು ಹೇಳಿದೆ. ನೆಕ್ಸ್ಟ್ ನಾನೀಗ ಎಂಟರ್ ಆಗ್ತಾ ಇರೋದು ಡಿಸೀಸ್ ಕಂಡೀಷನ್ನಲ್ಲಿ. ನಮಗೆ ಯಾಕೆ ಈ ಪ್ರಾಬ್ಲಮ್ ಬರುತ್ತೆ, ಪ್ಯಾಥಾಲಜಿ ಏನು, ಅದರದ್ದು ಕಾರಣಗಳಿಂದ ಯಾವ ರೀತಿ ಮ್ಯಾನಿಫೆಸ್ಟ್ ಆಗುತ್ತೆ, ಡಿಸೀಸ್ ಮ್ಯಾನಿಫೆಸ್ಟೇಷನ್ ಅಂತ ಹೇಳ್ತೇವೆ. ಅದು ಹೇಗೆ ಆಗತ್ತೆ ಅಂತ. There are many turbinates. I told you before, this anterior, middle and posterior turbinate or inferior turbinate. 3 ಟರ್ಬಿನೇಟ್ಗಳು ಬರುತ್ತೆ, ಮೇಲ್ ಒಂದು, ಮಧ್ಯ ಒಂದು, ಕೆಳಗೆ ಒಂದು. There are 3 turbinates in the nasal passage. Even we can see by the torch. If you take the torch and if you see the nasal passage, you can see the turbinates. Like hypertrophied nasal polyp, we can tell. Nasal polyps. If it increased the size, that's called hypertrophy. Nasal polyp is the common, that's called turbinates. If it increased the size due to some infection, that may by the dust, some allergens, by that way, the turbinates will enlarge. ಧೂಳಿಂದ, ಯಾವುದೇ ಅಲರ್ಜಿಯಿಂದ ಟರ್ಬಿನೇಟ್ಸ್ಗಳು ಎನ್ಲಾರ್ಜ್ ಆಗುತ್ತೆ. By that enlargement of the turbinates, that will block the sinus head. I told you there are some sinuses with hypertrophied polyps that will block the sinuses. By that way, what happens? If there is any secretions won't coming through the nasal passage, it will stays there only, causing more heaviness in the head. That may be causing some infection also. That become infective sinusitis. Beginning it's only sinusitis. Itis means any inflammation. Itis ಅಂತಂದರೆ ಎಲ್ಲರೂ swelling ಬಂದರೆ itis means any inflammation. Beginning there is only inflammation. Later that secretions deposits there only. Slowly they will suffer from infective sinusitis. Then the problem begins, headache. That infection leads to headache. It may be unilateral or bilateral. One side ಆಗಬಹುದು ಅಥವಾ ಎರಡು ಸೈಡು ಆಗಬಹುದು, depending upon the block, because all the sinuses are not uniform. That shape may change by birth. It's not like similar, both should be like this, not like that. This shape may be vary, this shape may be vary. Anatomically this is not same. It may be frontal, it may be maxillary, wherever it may be, the shape is not same. That's why they will suffer from only one side block. If the block is here, they will feel more pain in the maxillary sinus. If the block is here, they will feel more pain in this side. If they do like this, they can feel the heaviness in the sinuses because fluid coming on that area. This is examination. Just tell the patient to bow his head, just do like this. They can feel the pain here. This is a normal examination in the clinics. Next, by the compressing this sinus area. By this area, they can feel lot of tenderness. This is one more examination to find out. This is clinically what we can do. The next we can do the imaging. There we can see the hypertrophied nasal polyps, fluid secretions, all we can see in the scanning report. This is advanced technology. Clinically we can do by examination. Just by the torch we can see the hypertrophied polyps. By the examination we can do. These are all simple techniques. ನಾವು ಕ್ಲಿನಿಕಲ್ಲೇ ಎಕ್ಸಾಮಿನೇಷನ್ ಮಾಡೋದು ಈಸಿ. ನಾವು ಚೆಕ್ ಮಾಡಿಬಿಟ್ರೆ ಗೊತ್ತಾಗ್ಬಿಡತ್ತೆ. ಕೆಲವೊಬ್ರು ಸಮಾಧಾನ ಆಗೋದಿಲ್ಲ, ರಿಪೋರ್ಟ್ ಬೇಕಲ್ಲ, ಆವಾಗ ನಾವು ಅವ್ರಿಗೆ ನೀವು ಸ್ಕ್ಯಾನಿಂಗ್ ಮಾಡ್ಕೊಂಡು ಬನ್ನಿ ಅಡ್ವೈಸ್ ಮಾಡ್ಬೋದು. ನಮ್ಮ ಸಮಾಧಾನಕ್ಕಲ್ಲ, ಪೇಷಂಟಿಗೆ ಬೇಕಂತ. ಅದಕ್ಕಾಗಿ ಸೊ we can conclude the diagnosis by the examination only. But some patient, they won't believe on all those things. No, what you told, I don't know. So I want some diagnosis report. Then we can send them for imaging. Otherwise not needed. In the ancient time, everything by the examination only. There is no MRI, no scanning, nothing. Nowadays we have a lot of techniques. They can take the benefit of that to cross verify it. Okay, this is one thing. This is about the sinuses. Where there is a block, there will be pain. Very interestingly, our body adjusts very well. Imagine there is a block in the right nostril. Body will block that right side only. It will release the left side more. It will increase that passage more. This widening of the free passage, closing of the narrow passage. Next, there will be deviation of the septums. Because body want to inhale more air, what it should do? So blocked passage, it will make more narrow. The free passage, it will widen it. Because it should take that quantity of air to the lungs. Okay, body will find out the way. So if there is a block in one side, there is more constriction in that side. Opposite side, it will widen it. Example for this patient, typically he is having sinusitis, right side sinusitis. He is having maxillary and frontal. If you touch here, he will feel pain, tenderness. And he can't inhale and exhale through the right nostril properly. Today we did Jalneti and all. But the hope is at least 20% is good. Some water is coming from left to right. So this is the typical case of right side sinusitis. This is both frontal as well as maxillary. Here also I have pain. Here also. When I was examining today morning, this swelling, we can see the difference in both the sides. ಅವನಿಗೆ ಇಲ್ಲಿ ಸ್ವೆಲ್ಲಿಂಗ್ ಬಂದಿತ್ತು ಅವರಿಗೆ. That swelling we can observe. It's a typical case of frontal and maxillary sinusitis. The remedy for that, what is the remedy for that? First line of treatment is to clean the nasal passage, clean the block. So we can do the Jalneti. Next is Nasya In Ayurveda, they told nasal treatment, Nasya to clean nasal passage. This is one of the important Panchakarma. Vamana, Virechana, Basti, Nasya, Rakta, Mokshana. Nasya is one of the important Panchakarma, the problems above the neck region. Just you can put 3 to 4 drops of medicated oil. This will clean the nasal passage. It will shrink the hypertrophied nasal polyp. ದೊಡ್ಡಾದಂಥ ನೇಸಲ್ ಪಾಲಿಪ್ಗಳನ್ನು ಸಣ್ಣ ಮಾಡುತ್ತೆ, ಆ ಬ್ಲಾಕನ್ನು ಕ್ಲಿಯರ್ ಮಾಡುತ್ತೆ. ಈ ಒಂದು ಅದ್ಭುತವಾದಂಥ ಗುಣ ಇರೋದು ನಸ್ಯಕರ್ಮದಲ್ಲಿ. ಅದಕ್ಕಾಗಿ ಆಯುರ್ವೇದದಲ್ಲಿ ನಸ್ಯಕರ್ಮಕ್ಕಷ್ಟು ಇಂಪಾರ್ಟೆನ್ಸ್ ಕೊಟ್ಟಿದ್ದಾರೆ. ನೋಡ್ಲಿಕ್ಕೆ ಸಿಂಪಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಅದು ರಿಸಲ್ಟ್ ಮಾತ್ರ ಸಿಕ್ಕಾಪಟ್ಟೆ ರಿಸಲ್ಟ್ ಬರುತ್ತೆ. ಅದಕ್ಕಾಗಿ ಕುತ್ತಿಗೆಯಿಂದ ಮೇಲ್ಗಡೆ ಇರುವಂಥ ಊರ್ಧ್ವ ಜತೃಗತ ಅಂತ ಹೇಳಿದ್ದಾರೆ. ಎಬೋದು ನೆಕ್ ಇರುವುದಕ್ಕೆ ನಸ್ಯಕರ್ಮ ಅದ್ಭುತವಾಗಿ ಕೆಲಸ ಮಾಡುವಂಥದ್ದು. Along with Nasya, they can inhale some medicated decoction or some essential oil. They can take the inhalation of the water, and we can give some medicine to decrease the swelling of the turbinate. By that way, the turbinate will become normal size. We can inhale easily, and all the secretions will coming out. This is the remedy for the blocked nasal passage. One of the main reason for the headache. Apart from this, the headache may be migraine headache. The headache may be by the pitta problem, acidity, gastritis, constipation, digestion problem, stress, tension headache. There are more than 150 types of headaches they told. In medical science, they told more than 160, I think so. They named 160 types of headaches. I told you some of the important types. There are some digestion problem, acidity problem, constipation problem. It will lead to severe headache. In Ayurveda, they told Vataja, Pittaja, Kaphaja, Sannipataja and Raktaja. Because of Vata problem, Pitta problem and Kapha problem. They named with a Vata problem, the running nose will be like watery discharge from the nose. This Vata. Pitta, yellow discharge from the nasal passage. With Kapha, white discharge from the nasal passage. They gave some comparison in Ayurveda. Vataja, Pittaja, Kaphaja. And one more important is Suryavarta, they told. With respect to sun direction, it will change. Suryavarta headache. Morning with sunrise, slowly it will going to increase headache. At 12 p.m., headache in the peak, maximum headache. Slowly it will decrease with sunset. This is called Suryavarta. With respect to sun movement, headache changes. This is called Suryavarta. We can compare this with Pitta. Because Pitta slowly increases in the day. At the mid of the day, it is in the peak. Slowly it comes down. And Vata increases. So there are many types of headache. In Ayurveda, some plants also told for the headache. We can use the Vacha, Ardraka, that means Shunti, Jyotishmati, Drona Pushpi, Dronapatra. This all we can use for the headaches. This works well. If you have any doubts, you can ask about headache, about sinuses and headache. Yes.
Are people born with this?
Pardon? It develops later. Nobody will born with this problem. Because of the exposure to the dust, it increasing day by day nowadays. Previously, there were less cases of sinusitis. Nowadays, everywhere there's a road, vehicles are traveling, industrialization. All these things will increase the headaches. See what happens, if there's any nasal block, it may be cartilaginous block, it may be soft block, or maybe hypertrophic polyps. They will partially remove that hypertrophic nasal passage. They will make the nasal cavity free for inhalation and exhalation. This is a surgical treatment. This is not completely they won't remove it. Partially they will remove.
Yeah, in Australia sometimes it's dairy. We have different milk, and so you can stop the patient having dairy.
Yes.
Some kids, and then they get better. I don't know what it's like here in India because you have different cows.
Yes.
We have a new milk in New Zealand around the world called A2 milk.
Yes.
That's a different protein, and that can be helpful as well. You know?
In India, maximum is A2 only. In India, the milk is maximum A2 milk only.
A2.
Yes.
So you already got a good cow.
Yes. Like here we have around 65 cows. All are A2 cows only.
Wow. Okay.
All are local breeds. That Jersey, Holstein, Redding, these are all A1.
Yeah.
All Indian breed, local breed, all are A2 only.
Yeah, America, New Zealand, Australia, A1. Europe still has A2. Yeah.
Only this Jersey, Holstein developed from Holland.
Oh.
They developed these breeds. They are all A1 category.
Okay.
All other, even in Brazil, they are developing Indian breed. That Gir.
Yes.
They will name Brazilian Gir. They took from India, they developed very well.
Yes.
It's a good achievement, really. We should appreciate their achievements. In India, we are milking Gir cow 8 to 10 liters. They are milking 30 to 40 liters.
Wow.
This is a great achievement. They developed in such a way. In nasal passage surgery, they will remove that block. It may be with hard mass or cartilage or with a hypertrophic polyp. They will remove that part partially, not completely. So after the surgery, if you are following like Jalneti or Nasya regularly, there is no need of operation again. If you don't follow anything, after 5 years or after 10 years, again you should go for surgery.
Even the breathing exercise will help.
Help, definitely. Pranayama helps well. Meditation helps well. Dhyana, so helps well.
So negative sinusitis ಒಂದೇನಾ ಅಥವಾ ಎರಡು ಬೇರೆ ಬೇರೆ?
By the ನೆಗಡಿಯಿಂದ ಸೈನಸ್ ಹೆಚ್ಚಿಗೆ ಆಗುತ್ತೆ.
ನೆಗಡಿ ಆಗಿದ್ರೆ ಎಲ್ಲರೂ sinusitis ಪ್ರಾಬ್ಲಮ್ ಅಂತಾರೆ.
ಅದು ಆಗ್ಬೋದು, ಆಗದೇನೂ ಹೋಗ್ಬೋದು. ನೆಗಡಿ ಎಲ್ಲಾಗಿರೋ ಮೇಲೆ ಆಗುತ್ತೆ. ಗಂಟಲಾಗಿದೆಯಾ?
ಶೀತದಲ್ಲಿ ನೆಂದರೆ ಅಂತ
ಆಗುತ್ತೆ. ತಲೆ ಮೇಲೆ ನೀರೆಲ್ಲ ಬಿದ್ದರೆ ಥಂಡಿ ಆಗುತ್ತೆ, ಸೈನಸ್ಗಳು ಎನ್ಲರ್ಜ್ ಆಗುತ್ತೆ, ಸೈನಸೈಟಿಸ್ ಆಗುತ್ತೆ.
ಬಟ್ ಅದನ್ನ ಅಷ್ಟೊಂದು ಹೋಗ್ಬಿಡುತ್ತೆ, 2-3 ದಿನ ಆದ್ಮೇಲೆ ಹೋಗ್ಬಿಡುತ್ತೆ.
ಅಲ್ಲೇ ಕ್ಲೀನ್ ಆಯಿತು ಅಂದರೆ ಹೋಯ್ತು. ನಾವು ತಗೊಳ್ಳೋ ಆಹಾರದಲ್ಲಿ, ಇಂಡಿಯನ್ ಫುಡ್ಡಲ್ಲಿ ಸಾಮಾನ್ಯವಾಗಿ ಸ್ವಲ್ಪ ಸ್ಪೈಸಿ ಇರೋದಿರುತ್ತೆ. ಸ್ವಲ್ಪ ಖಾರ, ನಾವು ಲವಂಗ ಹಾಕ್ತೇವೆ, ಚಕ್ಕೆ ಹಾಕ್ತೇವೆ, ಟರ್ಮರಿಕ್ ಹಾಕ್ತೇವೆ, ಹೆಲ್ಪ್ ಆಗುತ್ತೆ ಡೆಫಿನೆಟ್ಲಿ. ಮತ್ತು ನಮ್ಮ ಇಮ್ಯುನಿಟಿ ಇರುತ್ತಲ್ಲ ಬಾಡಿದು, ಫೈಟ್ ಮಾಡುತ್ತೆ, ಕಡಿಮೆ ಆಗುತ್ತೆ, ನ್ಯಾಚುರಲಿ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಯಾವಾಗ ಕಡಿಮೆ ಆಗಲ್ಲ? ಕಂಟಿನ್ಯೂಸ್ ಎಕ್ಸ್ಪೋಸರ್ ಟು ಡಸ್ಟ್, ದಟ್ ವಿಲ್ ಅಗ್ರಿವೇಟ್ಸ್ ದ ಕಂಡೀಷನ್. ಇಲ್ಲ ಅಂತಂದ್ರೆ ಕಡಿಮೆ ಆಗುತ್ತೆ ಡೆಫಿನೆಟ್ಲಿ.
ಬಟ್ ಇದು ಜಲ್ನೆಟಿ ಎಲ್ಲ ತಲೆನೋವು ಅನುಕೂಲ ಆಗುತ್ತೆ.
ಹೌದು, ಎಲ್ಲರೂ ಮಾಡ್ಬೋದು. ನಿತ್ಯ ಕ್ರಮದಲ್ಲಿ ಬಂತು, ದಿನಚರ್ಯ. ಎಲ್ಲರೂ ಸ್ನಾನ ಮಾಡ್ಬೋದು ಹೇಳ್ದಂಗೆ ವಾತ ಇದ್ದರೂ ಸ್ನಾನ ಮಾಡ್ಬೋದು, ಪಿತ್ತ ಇದ್ದರೂ ಸ್ನಾನ ಮಾಡ್ಬೋದು, ಕಫ ಇದ್ದರೂ ಸ್ನಾನ ಮಾಡ್ಬೋದು. Like Jalneti, all this is a routine process. It's told in yoga. It's kriya. Every day you can do Jalneti. Today we demonstrated Jalneti for him, for her. They did Jalneti. If you're interested, you can do tomorrow. Jalneti. It will clean the nasal passage.
ತಲೆ ಸುತ್ತು ಬೇರೆ, ತಲೆ ನೋವು ಬೇರೆ.
ಹೌದು.
ಈಗ ನನಗೆ ಯಾವಾಗಲೂ ಮಲ್ಕೊಂಡಿದ್ದ ತಕ್ಷಣ ಕುಂತಿದ್ದ ತಕ್ಷಣ ಅಂದರೆ ಭಾಳ ಪುಟ ಕುಂತಿದ್ರೆ
ಅದು ಬೇರೆ, ತಲೆ ಚಕ್ರ ಬರೋದು ಬೇರೆ.
ಅದು ಆ ಥರ ಆಗ್ತಾ ಇತ್ತು. ಆಮೇಲೆ ಇತ್ತೀಚೆಗೆ 3 ತಿಂಗಳಿಂದ ಮಲ್ಕೊಂಡಿರ್ತೀನಿ ನಾನು, ಜ್ವರ ಒಂದು 4 ವರ್ಷ ಇತ್ತು. ಅವಾಗಿಂದ ಹಿಂಗೆ ಮಂಚ ಎಲ್ಲ ಹಿಂಗೆ ಆಗ್ತದೆ ಇತ್ತು. ಇನ್ನೂ ಇಟ್ಕೊತಿದ್ದೆ ನಾನು, ಇದನ್ನೇ ಮಾಡೋಕ್ಕಾಗ್ತದೆ ಹಿಂಗೆ ಹಿಂಗೆ ಎಲ್ಲ ಇದು ಆಗ್ತಾ ಇದೆ.
ಅದು ವರ್ಟಿಗೋ ಅಂತ ಹೇಳ್ತೇವೆ. ವರ್ಟಿಗೋ ಪ್ರಾಬ್ಲಮ್ ಇಸ್ ಡಿಫ್ರೆಂಟ್, ಸೈನಸೈಟಿಸ್ ಇಸ್ ಡಿಫ್ರೆಂಟ್. ವರ್ಟಿಗೋದಲ್ಲಿ ಗಿಡ್ಡಿನೆಸ್ ಇರುತ್ತೆ, ಇಡೀ ಬಿಲ್ಡಿಂಗ್ ತಿರುಗಿದಂಗೆ ಅನ್ಸುತ್ತೆ, ಅದು ವರ್ಟಿಗೋ. ಸೈನಸೈಟಿಸ್ ಇಸ್ ಡಿಫ್ರೆಂಟ್, ಕಂಪ್ಲೀಟ್ಲಿ ಡಿಫ್ರೆಂಟ್ ಮೆಕ್ಯಾನಿಸಮ್. ವರ್ಟಿಗೋ ಆ್ಯಂಡ್ ದ ಸೈನಸೈಟಿಸ್. ಉಪ್ಪು ನೀರು 1 ಲೀಟ್ರಿಗೆ ಒಂದು 5 ಗ್ರಾಮು. ಭಾಳ ಹಾಕ್ಬಾರ್ದು. ಹಾಂ, ಒಂದು ಅರ್ಧ ಚಮಚ ಸಾಕಾಗುತ್ತೆ.
Did this exist 5,000 years ago?
Pardon?
Did this exist 5,000 years ago?
Yes. His name in Ayurveda told us Shirashula.
So they lived in the cleanest of place.
See, the sinus problem not only by the dust. This is one of the factor. Nowadays it is increasing by the dust. Not only this one, with our diet, with food. If you are taking cold type of food, it will increase the sinuses. ನೀವು ಥಂಡಿ ಪದಾರ್ಥ ಯೂಸ್ ಮಾಡಿದಂಥ ಸೈನಸ್ ಬರುತ್ತೆ. ನಾಟ್ ಓನ್ಲಿ ಬೈ ದ ಡಸ್ಟ್, ಇಟ್ ಮೇ ಬಿ ಬೈ ಅವರ್ ಫುಡ್ ಆಲ್ಸೋ. ಇಫ್ ಯು ಟೇಕ್ ಎಕ್ಸೆಸಿವ್ ಕ್ವಾಂಟಿಟಿ ಆಫ್ ಆಯಿಲಿ ಫುಡ್, ದೆನ್ ಫ್ರೈಡ್ ಫುಡ್, ಜಂಕ್ ಫುಡ್, this all the thing will affect the sinuses. And some patients, they are sensitive for some flowers. That's called pollen grains allergy. Like 5,000 years before also there are some trees, different types of flowers. They are sensitive for that. Some people, imagine I am born and brought up here, I am accustomed to this area, no problem for me. If I go to some other area, I don't know the trees of that area. Here I can go to all the type of forests, no problem for me. If I go to different forest, I may be allergic towards some of the trees. In the same way, for everyone.
They have the allergy season,
Yes,
pollen season,
yes.
where people go and just get injected.
In the month of winter and autumn, here we can see lot of urticaria cases. It's called Shita Pitta, lot of allergy all over the body. Some asthma cases increases with winter.
Yeah, in Australia you do for free, you can do hundreds
Yes,
of different tests for free, and then you can also do blood tests, a RAS test, and you can do so many tests for free. Free medical.
nowadays for the allergy, if you go to laboratory, they will do allergy test. They will make a big list of that. They will do absolute eosinophil count.
Fish, masks.
Yes, they will write almost all the food.
There's lists.
They will list out all. The best thing is, you can try that item. If you are sensitive, you can avoid. This is the best way. If you take the brinjal, okay, this if you get some discomfort, you can stop it. Take peanuts. If you feel some problem, stop it. If you are comfortable, you can continue it. This is called trial and error method. This,
Allergy related to gut bacteria or immunity being weak, or is sinus also something like that? Or no?
if your agni is good, if your fire is good, if your digestion capacity is good, then easily it will digest the things. Example, if you took some ice creams, okay, your digestion is good and quantity is less. Okay, body will digest completely, metabolize completely. Then it won't cause any sinusitis. If you took lot of ice creams, digestion capacity is low, it will affect the body. And occasionally if you are taking, no problem. If you are taking regularly, then you may feel more sinus problem.
ಕಿವಿ ನೋವು ಆಗುತ್ತೆ ಸರ್, ತಂಪಾದ ಕಿವಿ ನೋವು ಆಗುತ್ತೆ.
Yes.
ಈಜ್ಬೇಕಾದ್ರೆ ನೀರೆಲ್ಲ ಹೋದಾಗ
Yes.
ಅದು ಇದಕ್ಕೆ ಸಂಬಂಧ.
ಸೈನಸ್ಸಿಗೆ.
ಕಡ್ತ ಬರೋದು.
Ear problem, ear ache. Here's a mastoid sinus.
ಅವರು ಊಟದಿಂದ ಕೊಬ್ಬರಿ ಎಣ್ಣೆ ಬೆಳ್ಳುಳ್ಳಿ ಹಾಕ್ತಾರೆ, ಸರಿನೇ ತಪ್ಪಾ ಸರ್?
ಹಾಕ್ಬೋದು. ನೀರು ಇಲ್ದಿದ್ರೆ.
ಎಣ್ಣೆ ಬೆಳ್ಳುಳ್ಳಿ
ಅಂದ್ರೆ ನೀರು ಇರಬಾರ್ದು ಕಿವಿಯೊಳಗಷ್ಟೇ. ಹಾಂ,
ಕಿವಿ ಕೂಡ ನೀರು ಇರಬಾರ್ದು.
ಕಿವಿಯೊಳಗೆ ನೀರು ಇರಬಾರ್ದು ಅಷ್ಟೆ. ನೀರಿದ್ದ ಪ್ರಾಬ್ಲಮ್, ಮತ್ತು ಇನ್ಫೆಕ್ಷನ್ ಆಗಿಬಿಡುತ್ತೆ. In Ayurveda, they told this Nasya Karma every day. This is called daily regimen. Putting 2 drops of oil to the nasal passage, this is a daily regimen. Applying the oil every day, this is told in Dinacharya. Applying this kajal to the eyes, this is told in Dinacharya. Applying 2 drops of oil to the nasal passage, told in Dinacharya. ಯಾವುದೇ ಎಣ್ಣೆ ಹಾಕ್ಬೋದು ನೀವು, ನ್ಯಾಚುರಲ್ ಆಯಿಲ್ ಆಗಿರಬೇಕು. ದಿಸ್ ಟೋಲ್ಡ್ ಇನ್ ದಿನಚರ್ಯ. ಆ್ಯಂಡ್ ಆಯಿಲ್ ಪುಲಿಂಗ್, ಯು ವಿಲ್ ಡೂ ದ ಕವಲ ಗಂಡೂಷ, ದಿಸ್ ಇಸ್ ಟೋಲ್ಡ್ ಇನ್ ದಿನಚರ್ಯ. ಟೇಕಿಂಗ್ ಶವರ್ ಎವ್ರಿ ಡೇ, ದಿಸ್ ಇಸ್ ಟೋಲ್ಡ್ ಇನ್ ದಿನಚರ್ಯ. ಎವ್ರಿ ಡೇ, ಡೈಲಿ ರೆಜಿಮನ್. ಸೊ ದಿಸ್ ವಿ ಶುಡ್ ಡೂ ಎವ್ರಿ ಡೇ.
So would that have helped during Corona as well, when people lost
Yes,
sense of smell and taste?
definitely helped a lot. We recovered almost all the cases. They lost the smell, taste, everything. We advised Nasya, nasal drops every day, and rinsing the oral cavity every day. Everyone got the smell and taste. Those who are having problem with smell and taste, they can practice from today.
How about people who snore at night?
Again there is a block with the turbinate. There's a vibration of the turbinates, right? When they snoring, when they snore it begins from the turbinates.
Right.
From the turbinate.
Right. Exactly.
Yes.
So they should also be doing the
First with the turbinates, then in the throat.
right.
Turbinates vibrations. Here is a turbinate, inferior, middle, and anterior, plus throat. If you do the Nasya every day, it will decrease the hypertrophied polyps. This vibration will decrease.
Different parts, isn't it? So
Yes.
Some people can lose weight and the back of their throat gets wider. And they
Yes.
stop. I had a captain of the England cricket team, what's his name? Whatever his name was. And he'd broken his nose. So he was snoring, he had sleep apnea. They fixed that.
Yes.
Fixed. Pretty cool. English captain.
ಕರ್ಣಪೂರಣ ಅಂತ ಮಾಡಿದ್ರೆ ಅದು ಬಹಳ ವಿಶೇಷ ಅನ್ನಿಸ್ತು. ಫಸ್ಟ್ ಟೈಮ್ ನಾನು ಕೇಳಿದ್ದು. ಅದು ಎದಕ್ಕೆ ಸರ್ ಅದು ಮಾಡೋದು?
It will strengthen the ear tympanic membrane. ಕಿವಿಯ ಒಳಗಿರೋ ಟಿಂಪ್ಯಾನಿಕ್ ಮೆಂಬ್ರೇನನ್ನು ಸ್ಟ್ರಾಂಗ್ ಮಾಡಿಕೊಡುತ್ತೆ. ಅದು ನಮ್ಮ ಹಿಯರಿಂಗ್ ಕೆಪಾಸಿಟಿ ಹೆಚ್ಚಿಗೆ ಆಗುತ್ತೆ. I was telling about Nasya. It looks like just cleaning the nasal passage, but in Ayurveda, they told Nasahi Shiraso Dwaram. This Nasya will helpful for the problem inside the brain. Many of the modern doctors, they argued me how it is helpful. If you put 2 drops of oil, how it will enter the brain? There is no passage, right? It can't able to go to the brain. But this is possible. This is told in Ayurveda 5000 years before. 5000 ವರ್ಷದ ಹಿಂದೆ ಹೇಳಿದ್ದಾರೆ ನಸೆ ಮೆದುಳು ಹೋಗಿ ಕೆಲಸ ಮಾಡುತ್ತೆ ಅಂತ. Even we got wonderful result in paralysis cases, facial palsy and hemiplegia. We got unbelievable result. Then I thought there may be some mechanism we should find out. Then I took all the modern textbooks, anatomy, physiology, everything. I go on studying the textbooks again. After completing my degree, I started studying again to find out there may be some mechanism. Otherwise, why they will tell Nasa hi Shirsodvaram. This Nasya, if you put 2 drops of oil, that will clear the block in the brain. They told. Then I got the reference in physiology textbook. There are some sinuses in the brain. Sigmoid sinus, cavernous sinus. Here, the specialty of sinuses are there is no walls. All the arteries, all the veins having some walls. Always venous blood moves towards the heart. Arteries blood moves away from the heart. Right? But here, so first we will do the facial massage, then steam bath. Blood circulation increases in the head by that way. Thus all the facial capillaries will absorb that oil that will bypass the heart. Directly they will reach the brain. So I noted down in the physiology textbook, not in Ayurvedic way, because modern doctors, they want to see it modern way. So I documented it that they mentioned these sinuses, they will absorb the blood from the facial capillaries and it will reach the brain. Because there is no walls, they can move in both the directions because there is no walls. There is a specialty in the brain.
It's a blood-brain barrier.
Yes.
Yeah.
There's some special reference that these sinuses are, there is having no walls, they can move in both the ways. So they will absorb the oil and they will reach the brain. They will clear the clot. We got this result, but we don't know the mechanism. Yes. Even we can use the ghee, oil, decoction. You have the capacity to. Yes. So oil based.
I have an off-topic question. Now, after Corona, a lot of people are reporting of clots in their body and especially in their head.
What's that?
Clots.
Really?
Yeah, like a lot of people have come up with clots
Yes.
in their bodies.
With the vaccine? Or
Yeah,
After the vaccine.
after the vaccine.
Vaccine.
So till 2018-19, I was seeing like 20 to 30 cases of this hemiplegia and facial palsy in a year. In a month of winter, I was seeing the patients. But after COVID and vaccination, I am seeing every month, 3 to 4 cases every month.
So it jumped up.
Yes. And there are some young people that died with some clot,
Yeah.
Oh, yeah.
heart attack.
It definitely increases.
A lot of
Yes,
people are dying
yes,
with it.
yes.
So would Nasya help
Definitely.
clear those clots in the brain?
They told this in Dinacharya. You should do every day, daily Rajivan. If you are following this every day, we can prevent it.
Now please show us a demo of how do we take it every day? Just like, do we just,
Yes, 2 drops.
do we take it deep in or do we just,
That's enough.
that's it?
That's enough.
Oh,
Next course of treatment, you will also have Nasya.
great.
Then he will come to know.
Yeah.
So this Nasya looks very simple. Just putting 2 drops to the nasal passage. Why it is told in main Panchakarma? Many ask this question. This may not be main Panchakarma, just putting 2 drops to the nasal cavity. How it will be a main Panchakarma? But the result is unbelievable. Even for cervical spondylosis, neck pain, some clot, sinuses, headache, like we have a lot of good benefit from.
Now why did you put that today?
For her, she is having neck pain.
So, an expression was like that. Different for her, right? Because of the side.
She is having cervical spondylosis. I was doing Nasya. She don't know why he is doing Sasya for me. I am having pain in the neck. One system will help for another one. This will have the special capacity to strengthen this neck area and increase the blood circulation from the cervical to the brain. This is all thing helpful. This Sasya karma. Any doubts about sinuses? Here I was explaining like very simply. I am not explaining what is told in the textbook. It should easy for you to understand it.
It was very easy for us to understand.
And you should be able to explain for other people. Then only helpful, na? Huh?
ಡೈಲಿ ಜಲನಿತ್ಯ ಮಾಡೋದ್ರಿಂದ ಅದನ್ನ ಅವಾಯ್ಡ್ ಮಾಡಬಹುದು.
ಡೆಫಿನೆಟ್ಲಿ ಮಾಡ್ಬೋದು. ಎಸ್.
ಅದರಿಂದ ತೊಂದರೆ ಏನಿಲ್ಲ.
ಅದಕ್ಕಾಗಿ ಆಯುರ್ವೇದದಲ್ಲಿ ಪ್ರಿವೆಂಟಿವ್ ಆಸ್ಪೆಕ್ಟ್ ಹೆಚ್ಚು ಹೇಳಿದ್ದು. ಬರೀ ತಡೆಯೋದು ಹೆಂಗೆ ಅಂತ. In Ayurveda, they focused mainly on the prevention aspect. Prevention is better than cure. They gave a lot of importance on the prevention. How to prevent nasal problem, how to prevent ear problem, how to prevent this major problem. They told detoxification every year. You should detoxify the body every year. You should regenerate your body every year. But we are not doing. Only we'll go to the hospital when we got sick.
Ultimate last point.
In Ayurveda they told you should do every year. See, before planning for the baby, before conception, they told detoxification. There may be some problem in the paternal side and maternal side. Father and mother. There may be some problem, we don't know. That problem will go to next generation. If you detoxify the body, if you clean the body, whatever problem you may have, it won't go to next generation. This is the main reason why at that time there are more healthy people. They are following regularly. After marriage, they will detoxify the body and they will plan the baby. That's the baby will be healthy. Even we can prevent some chromosomal problem also. Last time we treated one Down's case. First baby is Down's, second is Down's. They are planning the third one. In Manipal hospital, they strictly told, don't plan third one. There's a 99% possibility is there. First two are Down's. They are ready to take the risk for third one. Then I got an opportunity. I advised them the detoxification. Because why I planned means the male partner, he is taking some drugs. He's alcoholic, smoking, ganja, bhang, everything he is taking. Then I advised till that conception you should avoid. We detoxified the body, we regenerated the patient, and they concepted and they delivered this normal baby. Even in the familiar diabetes hereditary, they can plan for this treatment, detoxification. There are some hereditary problems, we can prevent it. This is the benefit of detoxification. In the ancient time they are doing. Nowadays everyone is busy. Not possible to come for 10 days. They will advise to taper it for 5 days. Everyone is busy. So they can't able to spend the time here. And they want all the treatment, whatever it may be, it's in the food or whatever treatment, they want with less price. They may be purchase 1 lakh rupees bag, but they won't be happy to give 500 rupees consultation for the doctor. One of my friends, same thing she told. One patient came for consultation in Bangalore city. She told 500 rupees consultation. They asked, why I should give 500 rupees for you? Just you give me some advice, that's it. That bag she took, this around 70,000-80,000 rupees vanity bag. I don't know, she knows that one. She told, Your bag is 70,000 rupees. So you are spending that much 70, but you are not giving 500 rupees doctor consultation. Then what she replied, that's my asset. This is these are my asset. Then the doctor replied, rather than this, your health is a big asset. So these are all things happening.
People want to wear Rolexes on their sick bodies and want to be happy about it.
If you don't have the health, what is the use of that?
Exactly. You're not going to
Health is one of the biggest asset. Your health is the biggest asset. If you are healthy, you can live happily.
Wealth means well-being.
Yes.
In English, Latin.
Yes.
If you're alive, you can make all the money in the world. If you're dead, then what are you going to do? If you're alive, you're going to make all the money in the world, right? And then you can buy all the Rolexes and the bags. But if you die, what are you going to do then after that?
See, the oil they are purchasing, this white oil and all, they are purchasing 80 rupees, 70 rupees per liter, this petroleum product. Yes. Natural oil costs 500 rupees. The patient's reply? Why I should give 500 rupees for this oil? I will take 50 rupees oil. I can save 450 rupees. If I sick, I will come to your clinic. You can give the medicine. That paracetamol or some antihistamine may cost 50 rupees. I can save 400 rupees, right?
Wow, seriously.
This is the mentality.
You cannot fight that.
Huh.
Yeah, you can't fight it, really.
You cannot let go of those kind of people.
Yes.
He's talking about the cold pressed oils and regular oils,
Oh yeah.
which are mixed.
In India, what happens? In the market, what you are getting is not natural oil. It's all petroleum product, white oil. Natural oil extracted from the grains, it will be very expensive. In India, maximum area you will get the chemical oils only.
Yeah, that's what I told the manager. If you look up the first page of Google, it says beware of going to Arabic because you can get heavy metals of
Yes.
mercury and arsenic because it's bad oils probably.
Yes.
Cheap oil.
See, the 1 kg of sesame cost 180 rupees. We need 4 kg of sesame to prepare 1 liter of sesame oil.
Wow.
180 into 4, 720 rupees only for raw material cost.
Yeah.
Okay? To bottle it and market it without any profit, it will be like 800 rupees. With your profit and all, it will be more. But in the market, we are getting 80 rupees. Ksheerabala tail or whatever medicated oil, you will get for 600 rupees, 500 rupees. How it's possible? Then we are not able to get the results. Ayurveda name also goes. Ayurveda also there is some bad name. This oil is not good. Ayurveda not works well.
Yeah.
There is some side effect.
Bottle content ಇರೋದಿಲ್ಲ.
These are all the things. ನೀವು ಹೇಳ್ತಾ ಇದ್ರಲ್ಲ.
ಈ ಹೆಸರಿಂದ ಡಿಮೆನ್ಷಿಯಾದ ಪಾರ್ಕಿನ್ಸನ್ ಅಲ್ಝೈಮರ್ ಅಂತದಕ್ಕೊಂದು
ಹೆಲ್ಪ್ ಡೆಫಿನೆಟ್ಲಿ ಆಗುತ್ತೆ.
ದಿನ ಮಾಡ್ತಾರೆ ಅದನ್ನ.
ಅದಕ್ಕೆ ದಿನಚರ್ಯದಲ್ಲಿ ಹೇಳಿದ್ದಾರೆ ಆಯುರ್ವೇದದಲ್ಲಿ ದಿವಸ ಮಾಡುವಂಥ ಕರ್ಮಗಳಿದು. ಸ್ನಾನ ಮಾಡೋದು, ಹಲ್ಲುಜ್ಜೋದು ದಿನಚರ್ಯ ಅಲ್ವಾ. ಅಭ್ಯಂಗ ದಿವಸ ಎಣ್ಣೆ ಹಚ್ಕೊಳ್ಳೋದು ಎಲ್ಲ ಅಭ್ಯಂಗ, ಇದೆಲ್ಲ ದಿನಚರ್ಯ. ಇದರಲ್ಲಿ ನಸ್ಯನೂ ಕೂಡ ಹೇಳಿರುವಂಥದ್ದು. ದಿವಸ ಮಾಡ್ಬೋದು, ಏನೂ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ. ನೀವು ಕೇಳ್ತಾ ಇದ್ರಲ್ಲಿ ಡೌಟ್ ಇದೆ ಏನಾದರೂ? ಮತ್ತೆ ಸೈನಸ್ ಬಗ್ಗೆ, ಹೆಡೇಕ್ ಬಗ್ಗೆ ನೆಕ್ಸ್ಟ್ ವಿಡಿಯೋದಲ್ಲಿ ಮತ್ತೆ ಯಾವ್ದಾದ್ರು ಒಂದು ಇದು ಮಾಡೋ ನೆಕ್ಸ್ಟ್ ಇದರಲ್ಲಿ ಟಾಪಿಕ್. ಇವತ್ತು ಇವ್ರದ್ದು ಸೈನಸ್ ಇತ್ತು ಅಂತ ಇವತ್ತು ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿದೆ. ಟುಡೇ ವೈ ಎಕ್ಸ್ಪ್ಲೇನ್ಡ್ ಆಲ್ ದಿಸ್ ಮೀನ್ಸ್ ಸೊ ವಿ ಗಾಟ್ ಒನ್ ಪೇಷಂಟ್ ಸೈನಸ್ ಟು ಎಕ್ಸ್ಪ್ಲೇನ್ ಹಿಮ್. So he worried a lot about his problem.
What else did he try?
ಖುಷಿ ಕೊಡುತ್ತೆ ಸರ್.
Huh?
ಭಾಳ
What else did you try before this?
So the
Were
stress
you doing regular medicine?
ಅಣುತೈಲ ಹಾಕಿದೆ ನಾನು ಸಕ್ಸಸ್ ಆಗಿಲ್ಲ ಧೂಳಲ್ಲಿ ಓಡಾಡೋದು ನಾವು.
ಸರ್ ಇದು ಸ್ಟ್ರೆಸ್ ಇಂದ ಬಂದಿದೆ.
He is exposing to dust.
ಸುಮಾರು ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗಿದ್ದೆ ನಾನು ಬಟ್ ಸಕ್ಸಸ್ ಆಗಲಿಲ್ಲ. ಓಡಾಡೋದು
Some of the things are undiagnosed in him.
ಬಾಯಲ್ಲಿ ಸಹ ತೆಗಿಬೇಕು ಆಟೋಮೆಟಿಕ್ ಬಾಯಲ್ಲಿ ಬರುತ್ತೆ.
So he simply is doing the treatment. They are not diagnosed this as a nasal problem. He took many remedies for that. So first we should diagnose it properly, then we should plan the treatment. Then we will get the good result. Simply if you are taking paracetamol for the headache,
Yeah, that's true.
ನೀವು ಕೇಳ್ತಾ ಇದ್ರಲ್ಲ,
ಅವ್ರಿಗೆ ಸ್ಟ್ರೆಸ್ ಇಂದನೂ ಬಂದಿದೆ ಸರ್.
by this way they will get the stress. Every day if you suffer the headache, definitely stress will increase. One day, 2 days, okay, no problem. If you suffer this headache from 10 years, anyone will get the stress.
You will just not be happy.
Not only headache, if you suffer from any problem continuously, you will be stressed only. You can ask her, she will have back pain for many years, she will be stressed. Whatever problem it is, if you suffer from that problem chronically from many years, definitely they will build the stress only. This is a common.
ಮಾಡೋದು ಅಂತ ಆಗ್ಬಿಡ್ತದೆ.
The resistance.
Yes.
I resist my problems, so it just, anyone that resists what is build it up.
They are very strong mentally, they will resist.
But that doesn't go away, it just stays with you now. You just resist
You gotta
it.